Welcome to the Beverly Hills Plastic Surgery Podcast. And today, I am here with my co-host, Dr. Millicent Rovelo, who does not fear the drain.
I love a good drain.
Me
Love
too.
it.
But the patients fear the drains.
Patients hate the drains.
They don't. They just don't know why they hate them. They say things to me sometimes, like it happened this week.
No, my patients actually hate the drains.
Do they hate the drains? Mine don't even realize they had the drains. Like when it's over, they're like, oh yeah, that's right, I had drains. Yeah.
So what we are talking about for the uninitiated are drains that are placed at the time of surgery. And these are typically thin silicone tubes that are in the area of surgery where you've been operated on, and they exit your body and they connect to a bulb, which looks like a bulb, and it collects the fluid that's under the surgical area. And they can stay in for any period of time. They're commonly used across all surgical specialties, but a lot of times in plastic surgery because we're doing so much skin and soft tissue manipulation. And when you manipulate soft tissue and skin and you elevate and you redrape it, the body's response to that kind of trauma is to produce fluid.
Yeah, you're opening spaces that between the skin and the underlying soft tissue, say like in a facelift or a neck lift or a neck lift with an upper facial extension, just to make sure that the men will listen also.
Yes.
And with that space under the skin, when we put it back down, we like to put a suction drain in to suck the skin back down and remove the fluid that builds up between the skin and the underlying soft tissue. And that's why drains are necessary. Now, there's all sorts of new techniques where I think we did a painless, drainless abdominoplasty podcast. And then we've talked about the hemostatic net, and we'll talk about it a little bit more today for the face, where you sew through the skin to the underlying soft tissue and sew the skin flap down to the underlying mass. These are all techniques that are designed to reduce the use of drains, but I can tell you that you still wind up using some drains in all of those situations, and it's not a big deal.
So it depends. That's a big, it depends.
But the patients think it's a big deal.
So let's go area by area. So you were talking about the face.
Right.
And in a facelift, neck lift with upper facial extension, you are having 1 to 2 drains, and they typically stay in 1 to 2 days.
Right. For the face, it's a very brief period.
And during those 1 to 2 days, you're wrapped up like a mummy. You're on pain meds. You don't really know what's going on. You have no idea. So
the fact that there's a drain there is like irrelevant.
No concern. Yeah, like there's
it's like
other
that some
things.
Leaves fell off the trees outside your like it's not relevant. It doesn't matter.
And then it comes out on day 2, and it's like it was
over.
never there.
Yeah.
So I think for the faces, having a drain in place is sort of like an oh, by the way, it's not a big deal. It'll be gone before you even really register that it's there.
But there must be an article on Reddit somewhere or something that says, oh my God, my doctor used a drain. Because like the patient's reaction, they'll be like, but am I going to have drains? Like they'll say it like that. Like there's, like, is a tidal wave coming? Because we should get to higher ground. Like it's a problem. Like we have to get out of here. I'm like, yeah, you're going to have drains. And I say it like what it is. Yeah, you'll have drains. And they're like, I don't know if I can do this. And literally this happened last week. They're like the visceral reaction of my patient told me that they were terrified of a drain. They were terrified.
There are a lot of internet forums out there, but buyer beware. If you're reading something on a forum, people are only going to post the most atrocious, awful things that happen to them because everybody wants to appear like a martyr and that they survived the worst ordeal. So
nobody should have it ever again.
And a lot of these experiences sometimes are over embellished, but you have to look at the end goal. What am I trying to achieve here? I came in for a facelift. I want to look amazing. I want to look better. Can I handle a nuisance that I'm not even aware of for 2 days to make that ultimate goal happen?
Yeah, it's irrelevant.
Yeah, you can.
And that's the thing. And somebody did have a problem with the drain. I'm sure somebody's had a drain sewn in.
Sure.
Yeah, they had to go to interventional radiology to cut things happen.
Sure.
So I'm not saying it's totally benign, but I was just sort of, it just took me aback that my patient had this it was like I said, there's a good chance you're not going to make it through this operation. Like, that's what I was saying when I said you're going to need a drain. Yeah, you'll have drains. And just the reaction was so overblown. I was like, there are 96 other things you should fear in this operation other than the drain.
Than the drains. Yeah, that's like number 100.
Let's talk about having general anesthesia, which is probably the biggest thing that you have to kind of say to yourself, do I really want to do this because I have to have general anesthesia? You wouldn't sign up just to have general anesthesia. You would do that because you have a reason to have an operation. So if you're beyond that, then the fact that a drain is placed is like whatever. But then there are people that then now use that fear as a marketing ploy. I don't use drains. And then people go, oh, thank God. Like there's this big relief that it's like the ultrasonic rhinoplasty. I won't get up. I won't get up on there. I know. Just hang on. I'm not going on the box. I'm not going to stand on the soapbox.
You got 1 foot up.
Maybe a foot. But like, I do ultrasonic rhinoplasty. I saw like some, I'm not going to say what doctor, kind of saying that because he does ultrasonic rhinoplasty, it's better. And I just want to see that data. I want to see their revision rates and that they don't have it. Like, no, you can't say that. That's not true. By the way, at the Roxbury Clinic and Surgery Center, we now have the piezotome, so we do ultrasonic rhinoplasty.
Okay.
Who cares?
Yeah.
You're cutting the bones. I don't care how you cut the bones. Make them look nice.
Right.
Cut them with a saw. Cut them with an ultrasound, piezotome. Cut them with, rasps, whatever. That's irrelevant.
Yeah.
And so
ultimately, it comes down to
how you did
results.
the operation.
Yeah.
So,
does it look good?
Right.
Does it not? Like, do I care really what the chef put in the food as long as it tastes delicious? I mean, kind of, yeah. But like a little bit. I might have some dietary issues. But like in general, I don't nitpick the spices that the chef used to make a delicious dish. As long as it comes out and tastes great, I don't need to know the nitty gritty.
No, and this stuff drives me. It really gets under my skin so badly. When I read this on this like expert in ultrasonic rhinoplasty, I wanted to reach through my cell phone and grab this guy by his white coat and just shake him. Just like, what is wrong with you? Like, how can you like say this? Like, how can you write these things and actually consider yourself a real surgeon? Like, how can you look at yourself in the mirror? Like, I'm right here. I just read it. Like, and you have to walk past me at a meeting and just think that guy thinks I'm a complete douchebag. I do. Because ultrasonic rhinoplasty is not a marketing ploy. Ultrasonic rhinoplasty is a technique. And it doesn't make sense that people are like, oh, I'm going there. And patients ask me that. Do you do ultrasonic rhinoplasty? It's like, okay, I'm off. I'm down.
You totally got
I'm going to get down now. I know I need to get on there, but I just, not only did I get up there, I got a megaphone. I had to, because I read this thing the other day and it just, oh my God, it's like... and it's unfair to the patients. That's why I always talk about this stuff. It is. It's unfair. I drainless. I don't use drains. Like, so what? Like, is it better? How are your results? Let's look at your before and afters. Let's look at your patient's recovery rates. Let's look at things that actually count, not the fact that your technique doesn't include drains. That's fine. It's fine. And that, by the way, this is time honored because there are people that used to talk about rhinoplasty I remember it because I heard an ad when I called, one doctor's office back in like the late 90s. It was like, I do rhinoplasty without packing. Now that is nice because packing is miserable. But do your noses turn out nice? Because the fact that you don't use packing doesn't necessarily mean you did a good nose job. But they're marketing with that point. And the drains have become a point, obviously, because the fear of my patient from me saying I use drains was like, it's off. It's a disconnect.
Right.
Don't you think?
It is a disconnect, but I also think you have to know what area you're talking about. So we've been talking about the face, and drains in this situation are like a non-starter. It's like, whatever. You're going to have them for 2 days. You'll barely register they're there. But in other parts of the body, and maybe sometimes this is where patients get confused, the drains can be a hassle. So
sure. Like abdominoplasty is where people comes up, they're annoying.
They're annoying, especially for my patients that have a lot of skin and I've made really big incisions. Those drains can stick around for 2 to 3 weeks, sometimes 4 if they're putting out a lot of fluid. So it's annoying because they're there for a long time. in my complex reconstruction breast patients or revision breast patients, sometimes I have to use drains in those patients. If I'm putting in any kind of ADM mesh, any kind of like complex breast reconstruction, frequently those patients have drains. And those are obnoxious because my rule, it's not every plastic surgeon's rule, my rule is I don't like my patients to shower if they have a drain sitting next to an implant. The whole bacteria, for me, that's just my thing. So they can't shower. So when I say my patients hate their drains, they hate their drains.
So your patients hate their drains?
My patients hate their drains because they're there painful for a while and
they can become painful.
And they can become painful. And the other thing too, so part of the thing with drains and any kind of recovery from a soft tissue surgery, the more activity you do, the more friction is generated internally. If you're all of a sudden doing a lot of laundry or cleaning or walking an hour around the block, you're going to create a lot of friction internally. That friction creates fluid, then fluid creates drain output, and then I can't pull the drain because it looks like there's a lot of fluid still coming out. So I'm like, well, you really can't do a lot of activity. I need you to stay home. I want you to isolate yourself. I don't want you to get an infection. So there are a lot of things that are annoying about having drains in place for other parts of the body.
But you need them.
But you need them because otherwise you can accumulate fluid. That's called a seroma. Seromas can get infected. They can cause capsular contracture around a breast implant.
Yes.
They can cause all kinds of problems that could be simply avoided if you just kept your drain in the appropriate amount of time, kept your butt on the couch, and followed your doctor's orders. It's annoying, but I promise you the end result is worth it. Just be a patient.
Yeah, I mean, I think you have to
And you
trust.
can hate your drains. You can hate the drains.
Yeah.
You can hate me all you want for putting the drains in. But at 6 weeks, you're welcome.
Yeah, I mean, the thing is that you have to trust your doctor that their technique is designed to get you the best result.
Right.
This is the thing. So if you need drains, you need them. It's not a big deal. They're going to be out. They're going to go away. I'm telling you, though, the fact that my patient had that reaction, I just feel like patients should understand it's not the end of the world, and it's not something to fear. You know, you don't fear the drains.
It's part of the process.
Get your result from the surgeon. That, you know, it just that shows that there's, you know, a lack of education, that there's a lack of knowledge, and that there's, you know, all this, you know, fear mongering about technique. But I think it's really designed as a marketing push for other, you know, surgeons that are saying, oh, I don't use drains, or, you know, I do ultrasonic rhinoplasty.
Get down.
I don't know if I know, but it's like I read that the other day. It's like, and you know, I just it's not that it's like.
Oh, he's still going.
I am because like, what do you do about like, you know, that sort of like, shouldn't he know better? Shouldn't that surgeon know better? That like, I'm looking, like I'm there. I specialize in ultrasonic rhinoplasty. Like, that sounds cool, right? Don't you want to go to the surgeon that does ultrasonic rhinoplasty? It sounds like he's going to like use a rocket ship or something to get you this amazing rhinoplasty. But what if the noses are ugly and it doesn't matter that he used an ultrasound? He doesn't know how to put in, you know, a spreader graft correctly. What if he doesn't know how to do a caudal septal extension graft? You know, should I say I specialize in caudal septal extension grafts? Ooh, he's special. I need a caudal septal extension graft. I probably should go to the guy who specializes in caudal septal extension grafts. Like, it's asinine, and it's unfair to patients, and, you know, it's not cool for medicine and for surgery for surgeons to wield BS against the patient population that they're trying to attract. And that's why it drives me crazy. And that's why I do get up on the soapbox about it. And it's why I don't get invited to many meetings anymore. Because, you know, like, this guy is going to be at the meeting. He's going to see me. He's going to be like, that guy thinks I'm a douchebag. And I'm going to walk by him and go, you're a douchebag. I said, that's not cool. And, you know, we have the piezo-tome. I got it because I want to teach the fellows how to use it. I'm using it on Tuesday. You know, it's not a big deal. I've used it many times. I've used it for all kinds of different things, lots of craniofacial surgery. It's not this magic trick that makes your rhinoplasty better. It's a tool that you use, and that's it. And drains are a tool that you use. If you do the hemostatic net after your facelift, great. You know, Chopra uses a hemostatic net and a drain. You know, it's like,
yeah, belt and suspenders.
Does that make him better? You know, should he advertise, I use drains and a hemostatic net? Who cares? That's what he does to get a great result for his patients. Ritu Chopra's a great facelift surgeon, period. It's not because he uses a hemostatic net and a drain. I do that. I use drains. I use hemostatic net. I do whatever. I do the thing that's going to give me the best result for the patient. And I don't make that the reason it's better. I make it part of the reason that I do things the way I do them. That's it. And so if patients come in and say, how are you going to do this? I will go through the techniques with them and I will tell them. And they sort of afterwards go like,
okay,
I don't really understand anything you just said. Because you don't. You're not a surgeon. It's like if I ask the guy, how do you get this F-16 up into the air? He could tell me and I just go like, great.
Okay.
If he left me there with that F-16 to try to do what he just explained, I'd be dead in 32 seconds because we don't know how to fly F-16s, So that's where I think, people have to understand there's a certain amount of, you got to go with the surgeon that's doing something good for you the way that they do it.
I could not agree more. Thank you, doctor.
Are you going to start doing ultrasonic rhinoplasty?
No, I don't do rhinoplasty at all. I leave that up to you.
Well, on Tuesday, I'll be doing an ultrasonic rhinoplasty. I just want you to know, and I'm going to make a really big deal about it. I think there's a New York Times article that's going to come out about that.
Well, best of luck to you.
Thank you.
And I'm so glad that we did this whole topic about drains and ultrasonic rhinoplasties.
Well, it's not that. It's about don't fear the drain. I know. It's just, just don't fear the drains. Yeah, it was impressive, the reaction that I saw. So anyway, you don't care?
No, I said don't fear it.
Oh, don't fear it.
It's all good. All part of the process.
And don't care. You shouldn't care about it. If your surgeon says I'm using drains, great. That means that you need them and it's going to be a good thing. So this is the Beverly Hills Plastic Surgery Podcast coming to you from the Drainless 90210.